My name is James McLaughlin. My friends all call me Tiny. Our district actually covers 539 square miles of mostly rural territory that surrounds Pikes Peak, which is also America's mountain. So it's where America the Beautiful was written. And we work in a rural community full of hardworking people, dedicated people that have very limited access to services and to the care that they deserve. I see people who often feel unseen. I hear people that often feel unheard. And helping them find the access to care that they deserve as a basic human right is meaningful to me. It's powerful to me. This is not a foot injury, right? This is Jill. And Jill is the single mother with 3 kids. And while she was stepping out of her car today, she slipped on the ice. She injured her ankle. And she's probably not going to be able to go to work today. And she is the sole breadwinner for her family. And they're already struggling to get by. And then when we show up, Jill is having what we think is an abnormally, overreactive response to the fact that she injured her ankle. But she's got all this other stuff going on. She's a whole person. And so getting down and understanding the whole person and being there to support them and let them know that together as a team, we're going to get through this crisis and we're going to help set them up with not just the resources they need to address that ankle injury, but let's empower them to have the additional information so we can treat the whole person. We live in an area that has healthcare deserts, meaning, it's 50 plus miles sometimes for people to go and access basic healthcare. And if they have an urgent care need, they're thrust into what is really just not an easy decision to make. Their first choice is they can take an ambulance to the emergency room or go to the emergency room, right? In the inherently most expensive place to receive care that's honestly not set up to address subacute needs. Or they can try and reach out to their primary care doctor, who often is overworked already and has very limited capacity to take an unscheduled appointment. The home program was all about creating that third option, which is really the whole purpose of community paramedicine and mobile integrated healthcare in the first place. We send this community paramedic out. They have the ability to provide basic level of service. And then we do a full head-to-toe exam in front of a board-certified emergency physician utilizing telehealth. And then together we discuss the options for treatment. Ultimately, the patient is empowered to make good decisions for themselves. Everything's centered around the patient and everything is about empowering the patient. We utilize motivational interviewing and trauma-informed approaches to make sure that the patient becomes the center of care. What integrating community paramedicine into our community has done is helped give a voice to people that have historically been marginalized. This isn't idealism. We know it's working. And how do we know it's working? Because we're collecting the data to tell the story. We know that we're saving an average of $2,200 in downstream costs every single time we alternatively destinate somebody or treat someone in place versus utilizing the traditional ambulance ride to the hospital, being able to show where the work we provide impacts the healthcare needs of the community on a broader spectrum, especially as it relates to the social determinants of health and how we're reducing the overall cost of providing care in the community. And we're increasing access to care, especially for marginalized populations like those in geographically isolated areas. And that's what it's about. It's not about avoiding a transport. It's about providing a better level of care. If you're looking to do treatment in place so you can get out of a transport, you're missing the point. If you're providing treatment in place because you know that patients do better when they get the right level of care in the right place at the right time for the right reasons with the right resources at the right cost, then you're on point.